Hi, welcome once again to Essential Nursing. This is your tutor. You guessed it, Nurse Judy. Today we are continuing our pharmacology series. Today's class of antihypertensives is called Angiotensin II receptor blockers, ARBs for short. I like to refer to these medications as direct siblings of calcium channel blockers because they kind of deal against the same enemies, angiotensin II. If we recall from our ACE inhibitors tutorial, the angiotensin II causes vasoconstriction, but the ACE inhibitors stop the process by inhibiting the conversion of angiotensin I to II. Here is a link to the ACE inhibitors tutorial for a quick recall. With ARBs, the already converted angiotensin II is not permitted to act because the receptors on the smooth muscles of the blood vessels are blocked, bringing about vasodilation. Remember, vasoconstriction is the goal of RAS mechanism. ARBs are used primarily to treat high blood pressure, that's hypertension, heart failure, chronic kidney disease, and other cardiovascular conditions. Typically, ARBs end in SARTAN, your losartan, valsartan, irbesartan, olmesartan, the list goes on. It's a tongue twister for me. The most common ones are the losartans and the valsartans. Side effects. The common side effects are dizziness and fatigue due to hypotension, that's low blood pressure. Patients can also experience headaches. Headaches may result from electrolyte imbalance, mainly too high potassium or too low sodium in the blood. The more severe side effects are hyperkalemia, that's elevated potassium. This will be due to the altering of the effect of the hormone aldosterone, which helps in the excretion of potassium from the body. This will in turn cause the accumulation of potassium in the bloodstream. Angioedema. Although not as common as in ACE inhibitors, angioedema may also occur with ARBs. The swelling will be seen in the face and in the throat, and it can be fatal. Renal or kidney dysfunction is another side effect. ARBs can cause a transient decline in kidney function. This can be due to the reduction in angiotensin II, which can lower blood flow to the kidneys. Because remember, blood pressure is reduced. This can happen especially when the kidneys of your patients are already dependent on high angiotensin II levels to maintain perfusion. Nursing consideration. Pay attention to the blood pressure and electrolyte balance, especially the potassium and the sodium. You also want to monitor the kidney functions because remember, the kidney may get compromised as a result of reduced force of flow of blood to the kidneys. Your creatinine, BUN, and your GFR are labs to watch out for because they indicate the state of health of the kidneys. Drug interactions. You definitely don't want to use ARBs with ACE inhibitors as they will increase the effect you're trying to get. You also want to question the administration of potassium-sparing diuretics, such as spironolactone, to prevent hyperkalemia, elevated potassium. NSAIDs also reduce the effect of angiotensin II receptor blockers. This is the end of today's tutorial. Please remember to comment below what other topic you need help with. Also, like, share, and turn on your notification buttons so that you can be alerted of any new posts. Don't forget to subscribe. Thank you, and see you in the next video.